Good morning, everyone. Thank you for joining us for our webinar today, the ABCs of Social Security benefits, employment options, and work support, and where to find the experts. Next slide, please. My name is Michael Rausch, and I'm the Director of the Real Economic Impact Network here at the National Disability Institute. Before we get started, I would like to share some housekeeping tips with you. Listening to the webinar. The audio for today's meeting can be accessed using computer audio or by calling in by phone. If you select computer audio, please make sure your speakers are turned on or your headphones are plugged in. If you do not have sound capabilities on your computer, or you prefer to listen by phone, you can dial 1-929-205-6099 and enter the meeting code 946-143-285. All right. Great. Captioning. Real-time captioning is provided during this webinar. The captions can be found by clicking on the CC button in your Zoom control at the bottom of the screen. If you do not see the captions after clicking the button, please alert the host via the chat box. You may also view captions in your browser at streamtext.net/player?event=NDI. Maggie, there's some background noise. Could you mute the other line? Great. Next slide, please. Submitting questions. Please use the Q&A box to submit any questions you have during the webinar, and we will direct them accordingly. If your question is not answered during the webinar, or you're listening by phone and not logged in, you may email me at mroush@ndi-inc.org. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the NDI host, or you may email my colleague Maggie Redden at mredden@ndi-inc.org. Please note, this webinar is being recorded and the materials will be placed on the following websites: at National Disability Institute, which you can go to nationaldisabilityinstitute.org/resources/webinars. You can also access the recordings on the Illinois Council on Developmental Disabilities website at www.illinois.gov/sites/ICDD. Great, and before we get into our presentation, we do want to do a couple polling questions. So on your screen, you should see the pre-webinar poll. If you could take a few seconds to answer these questions, that would be great. We'll take a couple seconds for you to answer these questions. Great. Thank you, Maggie. We can close the poll. Great. So thanks, everyone, for answering that. We'll do another polling at the end of the webinar today. So for those of you who are new to the National Disability Institute, we'd like to share with you a little bit about our organization. At the National Disability Institute, we envision a society in which people with disabilities have the same opportunities to achieve financial stability and independence as people without disabilities. At the National Disability Institute, we collaborate and innovate to build a better financial future for people with disabilities and their families. To learn more about our organization, please go to www.nationaldisabilityinstitute.org. One of the initiatives that we have, we're working to innovate and to build the financial stability and independence of people with disabilities, is the Financial Wellness for People with Disabilities initiative. This training initiative is working to build the awareness on financial wellness strategies for people with disabilities and their families. This initiative is in partnership with the Illinois Council on Developmental Disabilities, and we greatly appreciate their support to build a better financial future for individuals with disabilities. With that, I would like to introduce Marielle Hamer, who's the Associate Director of Program and Policy at the Illinois Council on Developmental Disabilities, to share a few words. Marielle?
Good morning, and thank you, Michael. Can you hear me okay?
Yep, you're good.
Okay. So I am so excited to welcome everyone to the webinar today. This is the third of many more that are to come. For those of you who are not familiar with the Illinois Council on Developmental Disabilities, our mission is to help lead change in Illinois so all people with developmental disabilities exercise their right to equal opportunity and freedom. The Council's vision is that every person in Illinois has the same rights, opportunities, and the ability to exercise choices so they can achieve self-worth and personal fulfillment in all aspects of life. What is important to know is that we are guided by a 5-year state plan and are excited to see the impact in increased individual and family advocacy in Illinois as a result of our grant with NDI. With that said, I want to thank the National Disability Institute for the rich resources they are bringing to Illinois. NDI has been shown to be effective in addressing unique needs of the developmental disability community as it relates to achieving financial wellness. This initiative with NDI will allow the Council the opportunity to provide a more targeted approach in providing financial wellness resources through education and training. Today's information is super important, and I'm very appreciative to all of you for taking time out to sit and learn. So with that, I will go ahead and hand it back over to Michael. Thank you.
Thank you, Marielle. We really appreciate you participating today and for the support of this initiative. So thank you. Great, next slide. So for today's webinar, we have a packed agenda. Today we're going to share a little bit of information on Illinois disability statistics, similar to what we've shared in the past. But today we're really going to look at sharing information on Social Security Administration's disability benefit programs. Learning how to navigate the public benefit system is a very important component to building for an individual to be able to navigate their public benefits, to be able to build their financial wellness. We will be sharing some complex issues. We'll also be sharing benefits information and counseling, looking at the resources and tools that you can access to learn more about public benefits, particularly those offered by the Social Security Administration. We will also have time for questions and answers at the end of the webinar, and then we'll close out by sharing with you an upcoming training opportunity in early part of 2020 that we will be hosting with the Illinois Council on Developmental Disabilities. Next slide. So we're very grateful today to have two amazing presenters. Our first presenter is our friend and colleague here at the National Disability Institute, Marlene Uliski, who's the Manager of Financial Empowerment and Disability Benefits. She's also a disability benefits expert with the National Research, the ABLE National Resource Center. We also have Ron Mulvaney, who's the WIPA Program Director with the Illinois Assistive Technology Program. And you'll learn more about the WIPA program, the Work Incentive Planning and Assistance Program. So with that, you all are in for a real treat to have these two subject matter experts share information with us on Social Security benefits. So with that, Marlene, I'm going to turn it over to you to get us started.
Okay, thank you, Michael, and thank you, Mario, also, and thank you to the Illinois Council on Developmental Disabilities for giving us this opportunity this morning. During the last webinar, I know that you learned from Katie Metz, my colleague, about the National Disability Institute 5 key financial strategies which lead to financial wellness. As you can see on your screen, they include, first of all, establishing a goal, benefits planning and work supports, which is our focus today, employment, free tax preparation, financial education and financial coaching, and finally, asset development. But before we go on, I wanted to explain what is benefits planning and work supports. And benefits planning means seeking out and securing the services of trained professionals who are well-versed in understanding benefits and how working affects any and all benefits an individual may receive. You'll hear the terms benefits planners and benefits counselors, but they refer to the same individual who has knowledge on work supports, which are also referred to as work incentives. You'll see some of those words used interchangeably during the presentation. And work incentives or work supports allow individuals with disabilities to maintain either cash benefits or Medicare, Medicaid, or other types of public benefits and to become self-sufficient or to supplement. As we go through this information, I just want you to keep in mind why benefits planning and work supports are foundational and a critical piece of the other strategies. As we walk through the slides, I think that you'll see that some of the information, which appears simple on the surface, may not be so simple to interpret or to use, and we highly recommend that anyone who chooses to work seek benefits planning services, which are at no cost. Now, you may wonder how something could be at no cost, but the services provided by a work incentive planning and assistance grantee, which you'll hear Ron talk about in a bit, they're funded by Social Security, and that tells you how strongly Social Security actually believes in the services. Now, my goal today is not to talk in depth about benefits or about work supports, but it's to provide you with the information so that you know why benefits planning, also called benefits counseling, it's a critical piece when an individual receiving one or more benefits chooses to work. On the next slide, let's look at some of the challenges an individual faces when they choose to work. And one of the largest challenges is navigating the maze of complex benefit systems and obtaining full and accurate information. Many of the fears are actually based upon incorrect information passed from neighbor to neighbor or from friend to friend, or some of the information may have actually been provided by a government agency which administers the benefit. After all, benefits are very complex, and when you ask a question of a federal agency and perhaps you leave out just one small detail, that can change the entire response to your question. A second challenge is the fact that beneficiaries who are unclear about the effect of working on benefits, they're less likely to move forward along the employment continuum. Perhaps they want to supplement their benefits and they fear losing them, or perhaps they've received conflicting information about benefits in the past, they're less likely to continue to work. Or perhaps many of you probably heard about individuals trying to work and being hit with a large overpayment. Now, will someone like that continue to work? I think not. And many individuals who receive a benefit from Social Security, they receive a lot of other federal, state, or local government benefits, and each of the programs can provide their policy, their rules, and information about their specific program, but not how the program fits in with the other programs or how it impacts all benefits that person may receive. For example, the rules pertaining to working and SSI and SSDI benefits They're not the same rules which apply to income and to earnings for the food stamps program. Or another example is the resource limits. They're different for Medicaid benefits, sometimes for Medicaid waiver programs or the Medicaid buy-in program. And when someone hears the word Medicaid, they think that it's just one program and the rules are straightforward across the board and they're the same. And that's not always true. Also, barriers to employment, they may be able to be overcome if supports and services can be identified and if a connection can be made. As an example, one barrier to employment may involve an individual who has an intellectual developmental disability and chooses to work. And perhaps he or she has tried to work, but it never worked out. Then they hear about benefits planning or benefits counseling that we're talking about today. They're referred to vocational rehabilitation. VR provides them with some of the services they need, including on-the-job training or job coaching. And with that connection and perhaps a later connection through their Medicaid waiver program, they receive additional job coaching services, which provides the support they need to continue to work successfully. In that regard, the benefits planner can also teach them how to use the Social Security work support and also tell them how an ABLE account may be able to help them. And again, as you can see, financial wellness, it continues when that benefit planner is involved. And finally, a large challenge is serving all of the individuals who choose to work. Because as you'll hear today, some of the programs we'll talk about, they have capacity issues and services may not be delivered quickly. And because of the last challenge, we've given you options in some of the, you'll hear later in the presentation on where to find some of the services you need depending upon where you are in the employment process. So on the next slide, so in light of all of the challenges, I wanted to start out briefly just by talking about the two programs under which Social Security pays a disability-based benefit. And I'm doing this as a foundational piece so that you have a greater understanding of the need for benefits counseling. Social Security, as you can see on your screen, they have two programs to support individuals who are unable to work at a substantial gainful activity level. Social Security uses a number as a guideline of substantial gainful activity. That number is $1,220 a month or $2,040 only if that individual is blind when someone is performing a job for either pay or profit. Now, when Social Security looks at whether or not someone's disabled, the first thing they look at is whether they're working at that level, and if they are, they're not disabled despite the severity of any medical condition. Now, for both of the programs, the definition of disability is the same for an adult, but disability is evaluated differently when the individual is blind and they're applying for supplemental security income benefits. Now, that first benefit is SSDI, Social Security Disability Insurance, the program for workers and their eligible dependents. And on the screen, I've listed only the dependents who have a disability and who may qualify on that record, like a disabled adult child or a disabled widow or widower. But I didn't list the others who may qualify on that record without a disability. Now, to qualify for that program, someone has to have worked recently enough and long enough and paid enough in Social Security taxes to qualify. It is not a needs-based program. Medicare comes along with it. In most cases, it's after 24 months. In this presentation, when I refer to SSDI benefits, I'm also referring to any of the other disability-based benefits paid under this program. To refresh your memory, for those of you out there who have heard about a disabled adult child, that's someone with a disability which began before the age of 22 and qualifies under a parent's Social Security record. Now, the other program is Supplemental Security Income Benefits, and that's an eligibility program for individuals who haven't worked enough or haven't worked long enough, and it's a needs-based program. And needs-based means that Social Security looks at income and they look at liquid resources like money in the bank or cash on hand to determine if someone is eligible. And in most cases, in most states, Medicaid comes automatically with SSI benefits, but Illinois is a Section 209B state, which means that Medicaid doesn't automatically come along with SSI. The individual has to apply for it separately. Okay, on the next slide, so moving on. Let's go a little deeper and we'll talk about some of the similarities in the programs. With similarities in the programs, there's a definition of disability for an adult. It's the inability to engage in substantial gainful activity by reason of any medically determined, that's a typo there, a determinable impairment or combination of impairments which has lasted or can be expected to last for a continuous period of not less than 12 months or result in death. Now, there's no temporary disability, it's only permanent disability, and an individual must be totally and permanently disabled under Social Security's definition. Another similarity is the fact that Social Security has several work supports or work incentives that provide assistance to working individuals to move from benefit dependency to independence or to supplement their benefits. They allow an individual to exercise their choice to enter, re-enter, or stay in the workforce, and again, to work at whatever level they choose by protecting their monthly payments and their health insurance coverage while they work. And the last similarity I listed with the two programs, it's the choice in obtaining services and supports under both programs. Individuals can choose from employment networks. And employment networks are organizations that provide employment or related services under the Ticket to Work program, and vocational rehabilitation, or from work incentive counselors, or from both. And with the last bullet, I wanted to emphasize choice in relation to work incentives, information, and counseling. Once again, I do want to emphasize that Social Security believes so strongly in the value of this counseling that they fund many of the organizations which provide the benefit counseling services. Now on the next slide, let's look at some program differences. And I included this slide so that you could see that identifying one's benefit is being paid under one program when it's actually paid under another program can cause quite a problem, particularly when someone chooses to work. In working with individuals who have a disability, and I've worked with them probably over several decades, more than I wish to admit, I could confidently say that probably over half of the individuals I've spoken with don't know what type of a benefit they receive or whether they're even receiving multiple benefits, which we'll talk about just in a moment. So you could see the differences, and I listed SSDI on one slide and SSI on the other slide. And SSDI, as you can see, has a financial cliff when someone is working over the substantial gainful activity level after applying and subtracting work support. In SSI, it's a little bit different. The SSI program subtracts certain exclusions under the law, and working causes an individual to lose $1 for every 2 earned, but they always end up with more money in their pocket by working. You'll also see some other differences. I won't go into number 2 or number 3, but you'll see with number 4 in SSDI, an individual can save any amount of money, and it doesn't affect benefits. But with SSI, there's a $2,000 resource limit. And if that limit is exceeded, an individual may lose their SSI benefit and their Medicaid benefit. I won't go into the others, but the last I wanted to mention is number 6. Most work incentives and supports, they're different for each program. There are a few which are the same, but again, most of them are different. So it's real important that you know which program, under which program you're receiving a benefit, or whether you're receiving benefits under multiple programs. And it's work incentives I think I want to talk about next and how they can help. So on the next slide, one of Social Security's highest priorities is to support individuals who want to work. And both the SSDI program and the SSI program include a number of employment support programs commonly referred to as work incentives or work supports. Now, the work incentives are special rules. They make it possible for an individual who has a disability and who receives a disability-based benefit to work at whatever level they choose, part-time or full-time, and to continue to receive monthly benefit payments or gradually transition off benefits or maintain Medicare or Medicaid. They must know the rules, though. And all of the rules or the work incentives are identified in the Red Book, as you can see on your screen in the link. It's www.ssa.gov/Redbook. And that provides you with a wealth of information about benefits and about the work incentives. So it sounds real straightforward and simple, but is it? So on the next slide, let's just look at this, look at a research study. It was completed by Mathematica, and Mathematica is a government contractor, and it's looking at beneficiary knowledge of work incentives. And Mathematica actually has done a lot of research under the Ticket to Work program since the law was passed way back in 1999. Now the data in this graph, it's about 7 years old or so, but it gives you a general idea of where we are in terms of beneficiary knowledge. The graph was compiled using Social Security data on work incentive usage and data maintained by the Social Security funded WIPA projects, and WIPA is Work Incentive Planning and Assistance Program projects, which Ron will talk about in just a second. Now you'll see in this graph there's 3 shades of blue on the screen. The darkest blue color, it shows the percentage reporting knowledge when they met with a WIPA project. The medium blue color, it shows the percentage of beneficiaries using work incentives at intake, at the initial meeting. And finally, the lightest blue color, shown on the right of your screen, it shows the percentage of beneficiaries not utilizing or not using work incentives, but the benefits counselor suggested they use it. Now notice the significant differences in what beneficiaries know about work incentives, what they're using, what they could be using. And this graphic, it kind of reminds me that very often someone will hear about a particular work incentive, but they won't know quite how to use it. They won't know where to go. They don't know what documentation Social Security needs for them to use it. And frankly, that's one of the main reasons why benefits counseling or benefit planning is so important. There's other reasons too why it's important. And one of them is complex issues. So let's go to the next slide. And then the next slide. And so who can work? And when someone asks this question, the answer seems simple enough or straightforward enough. Anyone can work. Someone who receives Social Security disability insurance benefits, someone who receives disabled adult child benefits, disabled widow or widower's benefits, or supplemental security income benefits. But oftentimes, when the question's asked, the answer isn't black and white. Therefore, it's just important to seek benefits counseling prior to starting to work so that there are no surprises. And I listed a couple surprises here on your screen, just so that you know that this step is really critical. These are things that I saw when I worked at Social Security. A work-triggered medical continuing disability review. Work can trigger a medical review if someone's case is diaried for review, medical improvement expected. So you need to know that, and that benefit counselor will know that. And there could be other unexpected surprises, an unexpected reopening of an allowance to a denial due to someone starting work a little earlier than they should have. They started working perhaps in their 5-month waiting period. That will change things, and that person will likely be overpaid. Or not realizing that depending upon how someone applies for benefits, they may not be eligible to use all of the work incentives. Perhaps someone applied for benefits using expedited reinstatement, and they think they have another trial work period, a 9-month trial work period, and it doesn't start immediately. They have to be on the rolls and receive 24 months worth of benefits before they're eligible for that. So someone needs to know that, and a benefits counselor can tell someone if they're eligible for that at that time. So on the next slide, to further complicate matters, individuals can receive benefits on more than, or they could receive more than one monthly payment from Social Security when they qualify on various records. You'll see concurrent entitlement when someone receives SSDI and SSI, or a DAC benefit and SSI benefit, or you'll see dual entitlement when someone receives a benefit under their own record and then a partial benefit under another record like a parent or a spouse. And you'll see simultaneous entitlement, and you'll see technical entitlement. So when all of these things happen, the work incentives are applied separately to each benefit. So depending upon when someone became entitled and where they are in the employment process, the dates of work incentive usage may be different. Also, someone may be receiving benefits under SSI and under SSDI, and those work incentives are applied differently. There also could be technical rules for continued eligibility that someone may not even be aware of. For example, if someone is receiving a disabled adult child benefit, if they marry other than another disabled adult child benefit, their benefit will terminate. So it's really, really easy, and you can see how it's easy to become overwhelmed because it does get very technical and complex. So on the next slide, and to add to that, how does employment affect other benefit programs? To add to what's already complex, many individuals who have a disability receive benefits from other programs. Some are means tested, some are not means tested. The programs shown on your screen, they may have different income or resource rules, and working may affect each differently. There's Medicaid waivers or housing and urban development assistance, SNAP or food stamps, low-income heating and energy assistance programs, Medicare savings programs, which pay Medicare Part B premiums and part of other costs, the Medicare buy-in, workers' comp, TANF, payments made under the Veterans Administration or Defense Department, and there's TRICARE. So there's just so many different benefits, it gets really complex. So what do you do? So on the next slide, you'll see you don't have to be an expert. Should you be an expert? And my answer is no. You really don't have to be an expert. You have choice in where you go for the information you need to make informed decisions about how employment affects your benefits, and you need to know the value of the information. You need to know where to find tools and resources that can help, and you need to know where to find those experts on all benefits received. On the next slide, benefits, information, and counseling. And then on the next slide, the Social Security Administration, they provide information about working and the effect on monthly payments in Medicare and Medicaid. They have various experts in the office called technical experts, work incentive liaisons, or an area work incentive coordinator and others. These employees actually have the highest level of knowledge or technical expertise, but they don't provide information on how working affects benefits other than those administered by Social Security. Now, the Social Security AWICs have done a great job, and they just completed earlier this spring a large national work incentives training initiative, and both of the Illinois AWICs played a critical role in training staff throughout the state of Illinois. But the problem is they provide information on Social Security benefits. They are not trained on providing information on other benefits an individual may receive. So on the next slide. Benefits information may also be obtained through the agency administering the separate benefit program. And some of the agencies are listed on your screen. There's Social Security, the Center for Medicare and Medicaid Services, the Department of Agriculture, Department of Defense, state or local agencies like the Department of Human Services, Housing and Urban Development, the local housing authorities, subsidized housing, and so on. But be alert for exceptions. VR provides benefits counseling, and federal and state-funded programs may or may not mirror some of the federal rules or the guidelines. And with this slide, Ron, I think I need to turn it back over to you because I think you were going to cover it. We just back up one slide. Okay, Ron, can I turn it over to you?
You certainly can.
I apologize, Ron.
No, not a problem at all. I've had my thunder stolen before, so it's all good. Thank you for having me. I'm the program director here in Illinois for the Illinois Assistive Technology Program, which Michael told you about earlier. One thing I want to say as I go through this, my responsibility in this presentation is to talk about where can you access information and also how to be prepared when you're talking with WIPA program. With this slide, the one thing I want everyone to understand is it's very difficult to comprehend a lot of this information. And with all of these different agencies operating in what I call silos, then you need to understand each individual program's rules. Now, what WIPA can do, or a trained benefits counselor can do, is they can help pull this all together. In 1999, when the Ticket to Work legislation was created, Congress realized that if you went to Housing and Urban Development, you learned about their rules. If you went to Social Security, you learned about their rules. If you went to the DHS office in Illinois, you found out about Medicaid and Medicare savings programs, et cetera. What we can do is pull all that information together so that you can have how benefits interact. So when you can contact, as Maureen said, these various agencies, but you have to know what questions to ask, because when you do ask a question at the highest level here, these federal agencies, they're going to answer your question, but they're not going to put the residual information around those questions, which is what WIPA is trained to do. So when you ask WIPA a question, or a trained benefits counselor, we put that residual information that is pertinent to that question. So just keep that in mind. The other thing I want you to understand is this is an ongoing building block type deal. You're not going to be able to sit down with a benefits counselor and learn everything you need to know in one session. This is very complex information. So relax, obtain what you can. If a benefits analysis is written for you, read through it more than once, because it is written in a very detailed way, but it's also very difficult information to understand. Okay, the next slide, please. Benefits counseling, as Marlene had said, is free. However, keep in mind, there are some programs out there that do charge. If you can contact a number of different entities to get information, which I'll go over in a moment, but you can also find help at the chooseworkssa.gov/find help. And I call that, we actually refer people to that program if they want to find various resources. Now, I like to tell people that we triangulate with other resources. We may triangulate with the Illinois Division of Rehabilitation, because they're going to do the benefits counseling piece. WIPA is going to do the benefits piece. So if you're needing support to prepare, we're going to make that referral to the Illinois Division of Rehabilitation or to an employment network. Or it may be that you have difficulty in filling out applications. We may make a referral to a Center for Independent Living, so that a specialist can help you fill out applications, organize your finances, and so on. So keep in mind those pieces, that there are other resources that we coordinate with, and we will talk about how to find those other resources on the next slide. In Illinois, Kaylee Raymond at the Illinois Division of Rehabilitation does benefits counseling. She accepts all individuals that receive Social Security disability benefits. Now, the prerequisite for anyone to receive WIPA services is first they have to be eligible for Social Security disability benefits, either Title II or what they call SSDI, and SSI benefits, one or the other or both, disabled adult child benefits as well. So the prerequisite is being eligible for Social Security, not in application, but being eligible. Once you're eligible, you can also contact an employment network if you want to receive services through them, and sometimes they have benefits counselors as well. And then the WIPA programs, which I'll give you in a moment, the two entities in Illinois that are assigned WIPA projects. They are more targeted and have a priority level of providing services. We haven't had a funding increase since 2006, So our main priority is working with individuals that are working, and especially people that are working above the substantial gainful activity level. The next priority would be individuals that are working below the substantial gainful activity level, but above the trial work period limit. And the third priority are people that are below the trial work period limit, earning less than the trial work period amount of $880 a month. And then the lowest priority is going to be individuals that, well, next would be the those that have a job offer, and then we would then be with individuals that are not currently working. What happens to us is that we get so many referrals that we have to apply this priority level, but I still know that people in contemplation need information. So I came up with a general information system so that if someone is waiting for our services, we can get them what we call a packet of information, which gives them the general information so that they can read through that, and then they can proactively contact us so that we're not chasing a lot of people around and eating up a lot of valuable time working with those individuals that are currently working. So we try to get that information to individuals as quickly as possible. And sometimes that's enough just to get the general information, and then it gets them into going for a job, and then we can do the comprehensive counseling for them. So had to create a system so that we get information to people, but we can't do comprehensive benefits counseling to everyone because we just don't have the staff to do so. Next slide, please. The Ticket to Work helpline, if you're wanting general information, this was set up by the Social Security Administration so that people could call and ask general questions. You can also find out the status of your ticket. And that number is 866-968-7842 or TTY 866-833-2967. So that's a place where you can also contact the national call center called the Helpline and ask those general questions. If you're needing additional information or you need more extensive services, they can make a referral directly to our WIPA program and the mayor's office in Chicago as well. Next slide, please. The acronym WIPA, and when I'm at presentations, often people have fun with the acronym, but it stands for Work Incentives Planning and Assistance. And I like to underline the whole word of planning, because even if that person is working, they may have goals, or they may get a opportunity to advance themselves with a raise or take another position, become a supervisor. You know, each situation is different. So we're here on an ongoing basis to help people strategize to move forward. And, you know, we put that burden upon the beneficiary that, hey, this is a process. We can't rubber stamp this for you. It's not going to stay the same. An SSI beneficiary, after they've paid in enough, they accrue credits. And once they get enough credits, they could become SSDI eligible. And then a different set of rules are applied. So understanding that WIPA counseling is an ongoing process to help people on an ongoing basis. You couple that with getting a lot of information from a lot of different entities over time and through experience. That anything we do, we gather and become better and have better knowledge as we proceed with, you know, visiting and revisiting the work incentives, the healthcare options, how housing is affected, and ongoing. We analyze we're very comprehensive. We look at all the benefits, and we help you understand how state and federal benefits interact. So it's not easy to comprehend, and often if an individual needs assistance, we can triangulate with a family member or an employment staff person, someone that's helping them find employment, or often a job coach may help someone sit in on counseling sessions. So whatever works for that individual is what we try to do to help each individual move towards their highest level of self-sufficiency. And that's going to be different for each person because we're all unique, and we all have our own approach in how we proceed. The Ticket to Work legislation in 1999, they actually call it the Ticket to Work and Work Incentives Improvement Plan Act. It came about because Congress knew that people couldn't get all the information. So we became a one-stop shop, like information people. I kind of call it like a traffic policeman who directs people on where to go and what information that they need. A general information may include SSI, SSDI, disabled adult child, but only the SSDI portion may apply to you. So when we do individual counseling, we only talk about what applies to you, not all of the other information that has been addressed in this counseling and in this presentation. We are all certified. We go through a very rigorous certification through Virginia Commonwealth University, and we have to do 18 credit hours every year of ongoing certification. So that ongoing training keeps us on the cutting edge to give you the right information and dispel myths. Next slide, please. 2 projects in the state of Illinois, the Illinois Assistive Technology Program that I am with. And then there's also, and we cover the entire state of Illinois minus the city of Chicago proper. And then the city of Chicago is covered by the mayor's office. And we sometimes collaborate with LaVonzell and her staff up there to help individuals that may move from our territory to theirs or vice versa. Or if the wrong referral comes in, we make sure that those people get contacted by the appropriate WIPA project so that they can get services. So we try to coordinate. We have to do training every year, and LaVonzell and I coordinate to get training for our CWICs each and every year as well. Next slide, please. Who is eligible? I think I kind of touched on this a while ago in my rambling, but prerequisite is a person that is first receiving Social Security disability benefits, either SSI, SSDI, disabled adult child benefits, disabled widows benefits, between the ages of 14 and the full retirement age. And this can become confusing at times because a few years ago, Congress extended the full retirement age all the way up to age 67, depending upon the year you were born. So if you're 66 years old and your full retirement age isn't until age 67, we can help you understand the transition between disability benefits into retirement benefits. Again, general questions can be given to the Ticket to Work helpline, which I discussed earlier, and the phone numbers are there for you. Expectations, we would like for individuals to come with an open mind and not be pressured, because it is very difficult for people to understand these benefits. So through this process of counseling, writing a benefits analysis, and then being able to ask questions of us to clarify that benefits analysis, people take that information and move forward with it. Next slide, sorry about that. Ongoing with eligibility, in-depth services for those that are working, have a job offer, actively interviewing for jobs, having an interview in the past 30 days, have a job interview scheduled in the next 2 weeks. They're a veteran or they meet transition youth of 14 to 25. Again, we have a priority level. Not everyone that meets this eligibility criteria will get in-depth counseling, but we will do our best to get them the right information they need so that they can get basic information so they can make a decision about moving forward. So I wish in my ideal world that I could counsel every person that I contacts us. And if that person moves towards employment, we will do the comprehensive counseling. But there may be a longer wait for those working at a lower level than those at a higher level. Individuals can also, if they want that general information, again, can get information either from the Ticket to Work helpline, which is listed here, or they can also call the helpline, the help desk, to get more information. Next slide, please. We assist beneficiaries in getting the right information about employment, discuss their work goals. We make referrals, give them the contact information to the appropriate entities that can help them. Division of Rehabilitation, Employment Network, a Center for Independent Living, IPS programs in Illinois is a program. It was created by Dartmouth, which is evidence-based supported employment for individuals with psychiatric, needing psychiatric assistance, so they can help someone to go to work and improve their mental health by employment. We verify benefits. We help them understand employment's effect on all the benefits, not only their Social Security disability benefits, but also their health care, their SNAP benefits, housing. So it's a very comprehensive approach. And those supports are very important to help that person, sustain employment. So we try to make that a priority to help individuals get all the supports that they need. Next slide, please. And I don't think that this is my slide, Marlene, but I do appreciate the opportunity to go over that with everyone.
Okay, thanks so much. And I guess we're going to wrap up and talk about enhancing your financial future. And just know that, and I think you've seen already throughout the presentation, that the benefit programs administered by Social Security are very complex, and we recommend that you seek the professional services of a community work incentives coordinator or a benefits counselor, just so that you can make good decisions for yourself. You're building your financial future and your family's financial future. We know that it is possible to work and to come out ahead financially, even when your benefits are reduced or they're seized, and a benefits counselor can show you that on paper. Working also is the only way to increase your monthly benefit amount or the monthly benefit payments to any dependents paid on your record. Know that you can work at whatever level you choose. You could either maintain your benefits, keep your Medicare, your Medicaid, or transition off benefits when you do understand the rules, and a benefits counselor can help you with that. It is possible also to receive benefits again if they're lost. There are a lot of safety nets built into the system. Your situation, as Ron said, your needs and your goals are unique. Make wise decisions, maintain good records and receipts. Again, a benefits counselor can work with you and show you how to do that, and also show you how to report your work to Social Security. But gathering information from trusted sources and locating resources is key. On the next slide, we've given you some next steps to go through, and I won't read them all in the interest of time, but when you have a chance, just go through them. They're just next steps to get you on your way to financial wellness. On the next slide, we've provided you with some resources, and again, most of the resources or some of the resources are from the National Disability Institute. We have a multitude of webinars available on our website. We have provided a resource on where to obtain assistance from a community work incentives coordinator or from vocational rehabilitation. We've provided you with a link for the Social Security Red Book, and we've provided you with a blog on how working will affect benefits. You can go to those at your leisure and read over some of the material that we've provided. So with that, I think, Michael, I want to turn it back over to you.
Great. Thanks so much, Marlene, and thank you, Ron, for sharing this great information with us today. We really appreciate it. We have 5 minutes left, but before we close out and address a couple questions, Maggie, we would like to put the polling questions back up, and we would like to ask everyone to take a few seconds to complete or answer each of the questions, the 3 questions that are on your screen. All right, Maggie, we can go ahead and close up the poll. Great. Thank you all so much for taking a few seconds to answer that. I do want to share with everyone that the presentation slides are available, will be available on the NDI website that we shared earlier. And we will, you'll also receive an email with the archive of the recording of this webinar. And that usually comes out via email to everyone who registered in about a week. Within a week, you should receive it. We don't have much time, but I do want to have a couple questions, send a couple questions to our presenters. Presenters, please note that we only have 3 minutes, so this is like a speed round to try to answer the questions. The first question that's come in is that, and Marlene, if you could address this, are there training programs on benefits that we can take? So they're asking if there's other trainings to get more information.
There are some training programs. I know what I would particularly be interested in is training in my particular state, and I think Michael will talk about that in a minute. There's some train the trainer sessions that will be coming up in Illinois, so I would first be interested in that. You can go to our website, to the National Disability Institute, and there is some training posted there. Those are the best trainings that I can recommend. Great.
All right. Thank you. And we will, in addition to the resources that Marlene shared, there's a variety of webinars on Social Security benefits that's on the NDI website, but also some other tools on the Choose Work site that people can access. So great. We really appreciate the great response we received today. Next year in 2020, we will be doing another webinar series, and so let us know if this webinar was beneficial to you, and we can look to see to create additional webinars on understanding Social Security benefits. Next slide, please. So I do want to share with you the opportunity to learn more. As Marlene had mentioned, we will be doing a Train the Trainer session, our trainer session on a new curriculum that's been updated for the state of Illinois on financial wellness for people with disabilities. This training will take place in February, and we just got the location yesterday, and it will be held in Springfield. And look out in December as we will be sending out the registration link for people to be able to apply to participate in this free training that looks at a variety of financial wellness strategies, including disability benefits for people with disabilities. So be on the lookout for more information on that training. Next slide. If you have any questions on this project or on financial wellness strategies for people with disabilities, please send us an email at ask@ndi-inc.org. Next slide. Again, I'd like to thank the Illinois Council on Developmental Disabilities for their support in building the financial wellness for people with disabilities and for their support of this initiative to bring this information to the state of Illinois. I'd like to thank again our presenters, Marlene Ulipski, Ron Mulvaney, as well as thank my colleagues Lori Schaller, as well as Maggie Redden at the National Disability Institute for all of their work to put this webinar together. So we're at the top of the hour, and so we'd like to say thank you all again so much for participating. This is the end of our webinar series for year one, but be on the lookout because next year we'll do another 3-part series as well. Have a great day, everyone.